Welcome, welcome, my dear friends. Myself, Professor Dr. Rajendra Raghuveer Deshpande from Pune, Maharashtra State, would like to welcome you all in my Ayurveda Academy YouTube channel. As you know, I am MD in Ayurvedic Medicine and MD in Ayurvedic Physiology. For paid online consultation, you can definitely WhatsApp on 9226810 My dear friend, this is the series where Dr. Deshpande is discussing the different health problems of the patient when the patient is coming to not in the hospital. We are discussing the problems at general medical practice with our family doctor. So today's case is 36-year-old male patient come to the doctor and he is saying, Doctor, see, I am getting severe headache, but in the evening since last 2 days, because I tried some simple things, putting some lap over here, but not getting relief. But in the evening only I am getting the bothering of this bad headache in the evening time. But this is now third day, so better way I come to you and please give me some medicines. Okay, okay. The doctor should start thinking headache in the evening are most of the time simple tension headache. Tension headache will not come in the morning after good sleep. It will also immediately after your office work, your business work, whole day you are having some stress here and there, and then in the evening the headache starts around about 5 or 6 o'clock and it goes away, goes on till you sleep properly. So this evening headache is most of the time tension headache. But let us check the other possibilities. Now the doctor should ask, hey my dear friend, tell me the exact area of the pain, where you are getting the pain. And one another question, whether you feel better after you press, like here, over your temporal region. When you press over here or you make some band over here, do you feel better? Yes, doctor, you are correct. Actually, patient with the tension headache feel relieved by pressing on the temporal region. Try to understand, by pressing on the temporal region. One interesting thing according to Ayurveda I would like to tell you. Whenever there is two types of the Vata Prakop, because according to Ayurveda, this is a disturbance in Vata bioenergy. Try to understand little bit Ayurveda also. So there are two types of the pathology in the Vata imbalance. One is a Dhatu Kshayjanya Vata Prakop and second is Margavarodhajanya Vata. So first is related with the deficiency in your body, maybe of vitamins, maybe protein, carbohydrate, fat, whatever, minerals, but deficiency can cause the Vata imbalance. And second, obstruction, infection, ama, toxin, they can cause the Vata problem. But this case is called as a, whenever pressing, after pressing, the headache is relieved, that is Dhatu Kshayjanya Vata Prakop. So we have to give nourishing treatment, anti-stress management to the patient. Simple Ayurveda and modern a little bit combination. But if the pain increasing after bending that particular head, then that is Margavarodhajanya Vata. Now forget about those complicated things, okay? Then I ask the patient, do you have the cold problem? Watering from the nose? Then the doctor should press on the frontal sinus, maxillary, ethmoidal sinus. So pressing over maxillary sinus, ethmoidal sinus and frontal sinus for tenderness. If there is a tenderness, oh doctor, then this can be headache, can be symptom of sinusitis. Then next question connected with the sinusitis, do you feel the headache increased after bending forward? Yes doctor, you are right. Then that is again indicating frontal sinusitis headache. Okay. Tell me, do you feel little bit foul smell in the nose? Not really, doctor, but yes, sometimes. This also going favor of sinusitis headache. Okay. Next. My next interrogative question is, do you feel headache after reading? After reading or after seeing a movie, after seeing a mobile for a long time? Yes, doctor. This is happening. Yes, as you are tending toward the 40, this problem can be the refractive error. This can be the refractive error. Then the doctor should try to press supraorbital ridges for tenderness. Huh? So, in every case of the prolonged frontal headache, especially in the children and the young adult, these cases, I am not talking about this particular case of the tension headache, but any other cases should be referred to the ophthalmologist to check for the refractive errors. In the children, headache problem, in the young adults, headache problem around college going students, basically ophthalmic checkup is a must. Of course, I don't deny that for elderly also, sometimes ophthalmic checkup, especially retinal checkup, is important whenever the patient is having hypertension, because there are retina is damaged because of the 2 or 3 problems. Diabetic retinopathy, everybody knows, and the hypertensive retinopathy, everybody also knows. So that retinopathy or retina specialist checkup is necessary at the age of 40 plus above. Okay, because senior citizens, elderly, they get this type of the ophthalmic problem, and that can also cause the even glaucoma. Glaucoma is one of the important reasons. When eyeball tension is increased, the patient is getting headache. So these cases should be referred to the ophthalmologist. Okay. Now next, neck movement. You have to check the neck movement. Bend down, bend on the right side, look left side, look up. So all these neck movements, and if the pain is increasing, look for the tenderness of the neck muscles and the back muscles. This examination is must if the headache is here. There are different parts: frontal headache, then this temporal headache, occipital headache, parietal headache, vertex headache. All these are the areas of the brain. You have to accordingly, you can get the clue for the diagnosis. Okay. Next, my question to the patient: tell me whether you have any fever in these last 2-3 days. No, absolutely not, doctor. I don't have any fever, because not in this case, but I am warning you. I warn to the patient, I warn to the doctor, be cautious. Headache plus fever, especially headache plus fever plus projectile vomiting, and fever is high and headache is severe, then don't forget 2 possibilities. Number 1, emergency. One is meningitis and second is malaria. Meningitis and malaria can cause headache plus fever. Then whenever there is a chances of meningitis, always check the neck stiffness. Even tuberculosis, TB meningitis is giving you the headache, but that is insidious onset. Since last 1 month, the patient is complaining of headache, slowly, over several days, with the headache and mild fever in the evening, low grade fever in the evening rise of temperature plus headache can give you the idea about tubercular meningitis. But if the fever is high with little bit rigor, then immediately palpate the spleen, splenomegaly. That can indicate the malarial infection, and malaria can cause also the headache. Of course, I am giving you the different possibilities, differential diagnoses, different causes. The doctor and patient should think all about these causes. Never forget to check the blood pressure in each and every patient of headache. Don't miss. Always check. Now, normal blood pressure, everybody knows, 120/80 mm of Hg. 120 mm of Hg is a systolic blood pressure, and 80 mm of Hg is a diastolic blood pressure. Now, very interesting thing I am going to tell you, because nobody knows, or no common man is knowing about that. In hypertension, lower diastolic blood pressure is more important. If diastolic blood pressure 80, if it is 90, it is mild hypertension. If it is 100, still more hypertension. 110, moderate type of hypertension. Above 120, diastolic. In spite of 80, it is shooting up. That is hypertension. Because many people say, doctor, I am 160/80. Okay, that is hypertension, but nothing to be worried about. Okay, so hypertension, look for diastolic blood pressure. And for hypotension, check the upper blood pressure, 120. If 120 is going down 60, then that is serious. That occurs in the loose motions and vomiting. So many things I am telling you, my dear friend. So look this video many times and so you will understand each and everything. But I am telling you about blood pressure. If it is too high, that can also cause the blood pressure. So my dear friends, today in this headache problem, we have discussed many important words. Number one, you have to check for temporal pressure. That is again stress headache. Then here also occipital, that can be because of the cervical spondylosis problem, then sinus tenderness, ophthalmic checkup, blood pressure. If the fever is there, then the neck stiffness, Babinski's sign, malaria, splenomegaly. But this is simple stress headache, okay? Tension headache. So what we can give? Symptomatic treatment, analgesics and tranquilizers, okay? If headache is recurrent, that is that is little bit one must be very serious. If the repeated headache is there, recurrent headache is there, then definitely you refer the patient to your physician for checking the regular checking of the blood pressure, ophthalmic checkup, X-ray of the paranasal sinuses, PNS, then hemoglobin, anemic condition, WBC for infection. And if headache is going progressively, severity is increasing since last many months, 3, 4, 6 months, headache is not coming down. All you have done, ophthalmic checkup is complete, hemoglobin checkup is complete, X-ray is PNS, sinuses complete, everything is complete. Headache is not stopping. Headache is not stopping. Headache is going on, going on, going on. My dear friends, be serious and be cautious. And if your doctor asks you to do CT scan or MRI, do it. Please do it, because headache for several months is not a joke, my dear friend. It is not casual. Don't take it casual, because there can be space occupying lesion. Space occupying lesion, SOL. And the most important, there may be some tumor. It may be benign, it may be malignant. Better refer the patient immediately to the neurologist or neurosurgeon to take care of the prolonged, progressive increasing headache. And MRI, CT scan is abnormal. Be careful, be careful. I wish nobody should get such a problem, but today we have discussed the different issues regarding the headache. I request all of you, my dear friends, to like this video, share this video, and don't forget to subscribe my channel to boost Dr. Deshpande's energy. Don't forget to press the bell button icon to get the notification. Okay. I wish all the best. Take care and see you soon. Thank you.